Hello everyone, it's Dr. Nicole Rochester, founder and CEO of Your GPS Doc, back for another Patient Safety Awareness Week tip. So if you missed tip number 1 from yesterday, I encourage you to scroll back through and watch that video where we talked all about medication safety. So in today's tip, I'm going to talk to you about the importance of asking questions. In my role as a health advocate and in my former role as a caregiver to my late father, and definitely in my role as a pediatrician, I cannot tell you all how important it is to ask questions and how your questions directly lead to you receiving better care. Now, that may sound a little weird, but I promise you, when patients and their family caregivers are actively engaged in their medical care and engage in dialogue with the physicians and the other members of the healthcare team, they receive better care. And part of that is because it just causes everyone to be on their P's and Q's. And I'm not saying that, doctors and nurses and other healthcare professionals are not always aiming to do their best. But the reality is sometimes things get in the way. And so when you ask questions, sometimes you bring that healthcare provider back to reality. You center them. You bring up things that are important, something that they may have forgotten or overlooked. And also, it positions you as someone who cares about your health or the health of your loved one. And you're sending out a signal that you are going to be an active participant in your medical care. All right, so what questions should you ask? These are the questions that you need to focus on every single time you seek medical care, or if you are a family caregiver, every time your loved one seeks medical care. The number one question is, what is my problem? You would be surprised to know that many people, in fact, more than 50% in some studies, are unable, when they're asked after an appointment, to accurately say what their diagnosis was. Now, part of that problem is on us, the healthcare providers, because that means that we are not effectively communicating with you. But part of that burden I'm going to put on you all, because that may mean that you're not asking questions or that you're not being actively involved in your healthcare. So, question number 1 is, what is my problem? What you're asking is, what is your diagnosis? What is actually wrong with you? Now, I know that when you go to the doctor or the emergency room or urgent care, or certainly if you're in the hospital, there may be 3 or 4 or even 5 things that are wrong with you. But typically, there's 1 or maybe 2 things that are just at the top of that list that are the top concern for your doctor and for you. And you need to know what that main problem is. You need to be able to articulate it in lay terms, but also you need to know the actual name of that diagnosis, so that if you have to go see a specialist or if you end up seeing another doctor, that you can easily say exactly what is wrong with you. All right, so that's the first question. What is my problem? The next question is, what is my treatment? You need to be very clear. What is the doctor recommending for that problem? Maybe you need to take a particular medication. Maybe you need to have a particular study, an x-ray or a CAT scan or an MRI scan. Maybe you need to go see a specialist. Maybe you need to have some type of procedure. Maybe there are things that you need to stop doing, or other lifestyle related things that you need to start doing, like exercising. So it's very important that you clearly ask the doctor, what is my treatment? The third question is, what are the alternatives? Now, this is where it starts to get juicy, because most patients and family caregivers don't ask that question. And guess what? Most doctors and other healthcare professionals don't freely get into discussions about that. It's not because we don't want to, but, again, time is very limited. And so in most cases, we just have time to tell you what's wrong, give you a prescription, and send you on your way, okay? But you always need to be aware that there is almost always more than one way to treat a particular medical condition. And so it's important for you to ask that question, what are the alternatives? And why is that important? Well, let's say that you have a particular condition and your doctor is recommending surgery. Maybe for whatever reason, you don't want to have surgery. Or maybe you don't want to have surgery right now. Maybe you want to know, is there something else that you can do to mitigate this problem? Is there something else that you could do first to avoid surgery? Similarly, maybe the doctor wants to put you on medication. Let's use diabetes as an example. Maybe the doctor is seeing you for follow-up and your blood sugars have been high for a while, and now the doctor says, okay, Mrs. Jones, it's time for us to start you on insulin. Well, hopefully they have already given you some other things to do prior to that, but let's just say that you are just really not wanting to start insulin, not that anyone is, right? And you want to know, doc, is there anything else that I can do? Is there anything else? Are there any other treatments? Is there a medication that I can take? Are there some lifestyle modifications that I can institute right now? And then I'll come back and see you in, 3 weeks, 4 weeks. Now, sometimes the answer may be no. Sometimes the thing that the doctor is recommending is not only the best treatment, but it may be the only treatment. But there may be other alternatives. And it's important to just engage in a brief dialogue about that so that you are fully informed so that you can make an informed decision. So you always want to ask, what are the alternatives? And then this is another one that most people don't think about, but it can be incredibly important. What happens if I do nothing? Now, for some of you, this may sound absolutely preposterous, that you would go to the doctor, that you would find out that something is wrong with you, that the doctor would then give you a treatment, and that your response would be, what if I do nothing? But in some cases, doing nothing is a viable option. For individuals who are terminally ill, meaning they have, less than 6 months to live, they may decide that the treatment that the doctor is recommending is going to cause them more pain and suffering than just living out the rest of their life. They may decide that they don't want to endure the side effects associated with a particular treatment. They may decide that they would rather have quality time, even if it's shortened, than to deal with some of the side effects and some of the complications associated with therapy. Another option may be that, maybe you're not terminally ill, but maybe for whatever reason, the treatment that the doctor is recommending just doesn't quite line up with your own values. That is okay as long as you understand the danger and the consequences of turning down that therapy. I need you to know that the doctor is the expert in terms of the medical expertise, but you are the expert for your own body, and you always have the right to decline therapy as long as you understand the consequences. Now, I am not out here proposing that you all should, decline therapy and delay therapy. That is not what I'm saying, because most times the therapies that we recommend are really truly what's best for you. But what I am advocating for is that you take agency, that you play an active role in your medical care, and that the decisions that you make are done in partnership with your doctor and with the other members of your medical team. So let's go over those 4 questions one more time. Question number 1, what is my problem? Question number 2, what is my treatment? Question number 3, what are the alternatives? And question number 4, what if I do nothing? Now, you don't have to ask all of these every single time, but I at least want you to be aware that these are 4 very important questions that can help you engage in a very meaningful dialogue with your physician and other members of your medical team. So I hope this was helpful. As always, please share this video with others who may find this information useful, and I will see you tomorrow for my next Patient Safety Awareness Week tip. Take care.